This talk is about embryology of the nervous system. It is the second part in a three-part series. This talk will be conducted using a question and answer format. The first question is, which of the following statements is not true regarding the embryological development of the spinal cord? A. The roof plate induces sensory neuronal development. B. The sulcus limitans divides sensory from motor regions. C. Neurons populate the intermediate zone. D. The marginal zone harbors neurons with mitotic capabilities. On post-fertilization day 29, the embryo looks like a tube with a significant number of somites. By day 53, the human characteristic of the embryo is clearly established. It is important to notice that these figures are not in scale. In a penny, at 29 days old, the embryo is about the size of Lincoln's forehead and half his nose. By 53 days, the embryo stretches maximal length is about the size of 2 pennies. Were we to cut the embryo at the site of the green lines corresponding to a thoracic spine, we would see two rather different structures. On day 29, we will see a very compacted, monotonous structure made of pseudostriated neuroepithelium, as you can see illustrated here, whereas from 52 to 55 days, we would see a more elaborate structure. Yet, as you can suppose, the transition between these structures is gradual. At 30 days, the tube is more elongated. By 32 days, the tube is less homogeneous. This difference is more noticeable by 33 days, and definite layering is established by 39 days. By 49 days, the appearance is certainly closer to an adult spinal cord, as it is at 52 to 55 days. I have now isolated and enlarged the last figure. I will now proceed to label some of its components. The central canal, ventricular zone, where neuroepithelial and progenitor cells are dividing. The intermediate zone, mainly composed of neuroblast, glioblast, neurons, and glia cells. And the marginal zone. The marginal zone is occupied mainly by glia cells and harboring the processes of neuroblast and neurons housed in the intermediate zone. Dorsally, you see the roof plate, ventrally the floor plate, and inside the canal, this mild indentation I have just pointed to is the sulcus limitans, which is the boundary between sensory and motor neurons. The structure I have just indicated is the dorsal ganglion, which arises from neural crest cells. Now, I want to call your attention to the roof plate. The cells in the roof plate influence earlier on in development by the ectodermal overlying the neural tube secretes bone morphogenic protein, a protein that belongs to the transforming growth factor beta family. This protein activates another protein called paired box or PAX protein. This PAX protein favors sensory neuron differentiation. This influence yields the alar lamina. Now, I'd like to call your attention to the floor plate. These cells secrete sonic hedgehog protein, which activate a protein with the unfortunate name of natural killer X2.2 and X6.1. These proteins favor motor differentiation and the formation of the basal lamina. Other structures present in this figure I'd like to call your attention to are the dura, the arachnoid, and the pia mater. These three structures are of mesenchymal origin. Some authors believe that the pia and the arachnoid are of neural crest origin. So the answer to this question is D. Next question. Which of the following neurons are present in the spinal cord? A. Somatic motor neurons. B. Visceral motor neurons. C. Visceral sensory neurons. D. All of the above. I hope you recognize this figure and all its components because I will use it to illustrate a few very important points. First, the secretion and intermingling of substances secreted from the floor and roof plates creates a gradient which I have represented here by blending of blue and brown. The second point is that it is the regional predominance of roof and floor plate secreted proteins that dictates the fate of the cells in a given region. Hence, neurons close to the roof plate bathed in high concentration or roof plate secreted protein will become somatic sensory neurons. These neurons, among other things, produce the fibers that will give rise to the spinothalamic tracts. Those exposed to a lesser concentration of roof secreted protein and to minimal amount of floor plate secreted substances will produce sensory interneurons, and those with a still prevalence of roof plate proteins but with a significant proportion of floor plate proteins will become sensory visceral neurons, carrying pain from abdominal and pelvic viscera. Neurons closer to the floor plate bathed exclusively by floor plate proteins will become motor neurons for striated muscles. Neurons predominantly exposed to floor plate proteins but also exposed to some roof plate proteins become interneurons involved in motor behavior. Those still exposed mainly to floor plate proteins but also to a significant amount of roof plate proteins will become visceral motor neurons. They give rise to sympathetic and parasympathetic motor neurons. Thus, it is the proportion of roof and floor plate proteins that will produce the functional organizational columns in the spinal cord. As illustrated here, I'd like you to be aware that this cohesive explanation fails to bring light to the fact that visceral motor and probably visceral sensory neurons are not present in most of the cervical spinal cord region. So the answer to this question is D. Next question. All segments of the spinal cord are created from the neural tube. A true, B false. Primary neurulation is the process involved in the production of the central nervous system from the mid-sacral region to the brain. This process, as you know, involves the neural tube. The lower sacral and coccygeal regions are generated by a different process. This process is called secondary neurulation. Secondary neurulation involves a group of cells close to the caudal region called the caudal eminence, to which we have alluded in previous video. The beginning of the process of secondary neurulation is depicted in this frame. This event starts by about day 26. At 26 days, the caudal eminence is a mass of cells near the caudal tip of the neural tube and close to the lowest sacral bone segment. Approximately at the time of neural tube final closure, by 28 days, the mass takes a U shape and approximates the caudal end of the neural tube. By day 32, the caudal eminence has made contact with the sacral bone and with the end of the neural tube. The part of the caudal eminence stretching between the caudal neural tube and the sacral bone is the future filium terminalis. The tissue attached to the rostral end of the neural tube goes on to form the lower sacral and coccygeal spinal cord. The tissue attached to the sacral bone forms the lower sacral vertebrae and coccygeal vertebrae. By 36 days, the caudal eminence becomes more slender, as you can see in this frame. By 8 weeks, the tip of the caudal eminence is as low as the 10th coccygeal vertebra. By the 20th weeks, at the level of the first coccygeal vertebra. By 40 weeks, the time of normal birth, it may be as low as the upper surface of L3, but not lower. In the adult, the tip may be as low as the body of L1. So the answer to this question is B. Next question. The spinal cord posterior columns are constituted by central axons from neural crest cells descendants housed at the spinal dorsal ganglia. A true, B false. In this frame, I am indicated to the central axons of the dorsal root ganglion cells. As you can see, as they enter the spinal cord, some of the axons travel a long distance in the posterior columns to reach the dorsal nuclei at the level of the medulla, whereas others travel for a short distance, ending up in the sensory neurons at the dorsal horn. It is important to stress certain points about the way central axons of the dorsal root ganglion neurons go into the spine. Those axons covered by myelin from Schwann cells are still myelinated in the spinal cord, but not by myelin produced by Schwann cells, but by myelin produced by oligodendroglia cells. It is interesting, as replicated in the just added figure, that under light microscopy, the transitional zone between Schwann cells and oligodendrocyte myelin can be appreciated at the dorsal root of each spinal cord a few millimeters before the spinal root enters the parenchyma of the spinal cord. This boundary is called the reddish Obersteiner zone, or ROZ for short. But what is still more interesting is that using electron microscopy, the segment occupied by the ROC does not show any morphological difference than the rest of the dorsal root. Instead, the change from Schwann cell myelinated to oligodendroglia myelinated axons occurs right at the point of entry of the axons into the spinal cord. Another structure that does not go into the spinal cord, in addition to Schwann cells, is the nerve basal membrane, which surrounds the spinal cord, as you can see in this frame. So the answer to this question is A. Next question. The inferior olive derived from the A. roof plate, B. floor plate, C. alar lamina, D. basal lamina. I hope you recognize this figure with all its label. Now I will remove all structure not directly related to the spinal cord, as you can see here. I will further simplify the remaining structures by presenting it as a cartoon, as you can see in this new frame. Notice that the labels have not changed. I will now remove the labels for sensory and motor interneurons. I have done so to simplify the figure and because for practical purposes, intermediate neurons can be grouped with their corresponding functional group type. Motor intermediate neurons with motor neurons and sensory intermediate neurons with sensory neurons. So we can now see somatic sensory neurons, visceral sensory neurons, and ventral to the sulcus limitans we find visceral motor neurons and somatic motor neurons. In this new frame, I have removed all labels to introduce the changes in the neuroaxis leading to the formation of the closed and open medulla. Nothing much changes in the external configuration of the closed medulla, other than a slight widening, mainly due to the appearance of the dorsal nuclei and the spinal nucleus of the trigeminal nerve. Yet, at the level of the open medulla, much changes occur. Some of these changes are represented here. We begin by saying that the roof plate disappears. As a consequence of the disappearance of the roof plate, the central canal makes contact with the pia mater. The pia mater, as in the prior figure, is represented here by the yellow line surrounding the structure. Next, there is lateral separation of the dorsal masses, as you can see in this frame. This separation has been compared to the opening of a book. The spreading continues and becomes more prominent in the middle and upper third of the medulla. As these external changes are happening, also internal changes are occurring. One of the most noticeable is the formation of the inferior olives. In this new frame, the arrows indicate the ventral migration of neurons from the alar lamina. The alar lamina at the medulla is referred by some authors as the medullary extension of the inferior rhombic lip. The masses formed by the migration of the alar cells are the inferior olives. We will talk a little more about the formation of the inferior olive in a short while when we talk about the formation of the cerebellum. So the answer to this question is C. Next question. Hearing and balance belong to the dash cranial nerve functional group. A. Spatial visceral afferent. B. Spatial visceral efferent. C. Spatial somatic afferent. D. Spatial somatic efferent. This drawing depicts a cartoonish representation of the central nervous system, which clearly separates the spinal cord and the brainstem. As you can see here, I will use this distinction to explain the terminology used for functional neuronal groups. The first group is constituted by neurons that innervate all non-branchial derived striated muscles. The second group is constituted by those neurons innervating smooth muscles and myoepithelial cells in the different glands. The third group consists of neurons receiving sensory information from skin and muscles. The fourth group consists of neurons receiving sensory information from thoracic and abdominal viscera and stretch receptors and chemoreceptors from vessels. The fifth group consists of neurons innervating the branchial-derived muscles. The sixth group consists of neurons involved in hearing and balance. The seventh group, those involved with taste. Neurons innervating somatic-derived muscles are present in the spine and in the brainstem. In the brainstem, they innervate muscles derived from precordial or somatic mesoderm, such as extraocular, eye muscles, and tongue muscles. Neurons innervating autonomic muscles are in the spine and the brainstem. Neurons involved in skin and muscle sensation are present in the spinal cord and brainstem. Neurons involved in visceral sensation are present in the spinal cord and in the brainstem. Neurons innervating branchial-derived muscles are only present in the brainstem and not in the spinal cord. This conclusion is disputed by some authors. These authors argue that the motor neurons housed in the spinal cord for the sternocleidomastoid muscle and the trapezius should be included in this group, since these muscles, according to them, are likely to be of branchial origin. In this talk, we will not dispute this assumption, but for the purpose of classification, we will work with the concept that motor neurons innervating the branchial-derived muscles are only present in the brainstem. Neurons for hearing and balance are obviously only present in the brainstem, as are those for taste. This compartmentation forms the basis of the classification of functional neuronal groups. Those present in the spine and the brainstem are called general. Those only present in the brainstem are called spatial. As you know, neurons whose axons conduct electricity away from the neuroaxis are called efferents. Those neurons with axons that conduct towards the neuroaxis are called afferent. I will make a few remarks about the classification of the spatial neuronal functional group. The term visceral is used for branchial-derived muscles and for taste. The term somatic is used for second neurons involved in receiving hearing and balance information. This classification is usually recognized by the initial of the different columns. Hence, we talked about GSE, that is general somatic efferent, GVE, general visceral efferent, GSA for general somatic afferent, GVA for general visceral afferent, SVE for spatial visceral efferent, SSA for spatial somatic afferent, and SVA for spatial visceral afferent. So the answer to this question is C. Next question. Which of the following cranial nerve functional groups is not present in the medulla? A. Spatial visceral afferent. B. Spatial visceral efferent. C. Spatial somatic afferent. the spatial somatic efferent. Now that we have a good grasp on functional groups, I will illustrate the changes occurring in the medulla at the level of the mid-inferior olive during development. To do so, we will go back to the last figure of the medulla to illustrate the changes undergone by neuronal functional group masses in the medulla at the level of the inferior olive. First, the masses split. Each of them splits in 3 groups. The consequence of this split is the formation of a column for general somatic efferent neurons, which at this level houses the motor neurons for the hypoglossus. By the side, we have the spatial visceral efferent column that at this level consists of the nucleus ambiguus innervating the branchial derived muscles of the pharynx, larynx, and 4 of the 5 soft palate muscles: palatoglossus, palatopharyngeus, musculus uvulae, and levator veli palatini. I have inserted an schematic representation of the adult medulla at the level of the inferior olive so you can see the nucleus ambiguus. Notice that the nucleus ambiguus has moved ventrally during further embryological development from its original position, but it maintains its position lateral to the hypoglossal nucleus. Next, we have the dorsal nucleus of the vagus. This nucleus provides parasympathetic innervation to all the regions of the body except those innervated by the parasympathetic fibers of the pelvic explantic nerve. As you can see in this frame, I have reintroduced the adult medulla to show you the position of the dorsal nucleus of the vagus, which is by the side of the hypoglossal nucleus. Before leaving the basal group, we must add a peculiar point that breaks the arrangement just described. This peculiar point is that a group of general visceral efferent neurons become, during development, displaced from the dorsal nucleus of the vagus and migrate to join the nucleus ambiguus. Hence, the nucleus ambiguus contains vagal efferent neurons that inhibit the heart rate. I will now go back and continue the flow of our story. Next to the dorsal nucleus of the vagus, at the level of the inferior olive, we have the general visceral afferent column that houses sensory parasympathetic neurons. These parasympathetic neurons receive information from the carotid receptors, that is, baroreceptors and chemoreceptors, and also from cardiac, pulmonary, and GI receptors that are involved in many vital reflexes. Just to the side of the sensory parasympathetic neurons at the mid-olivary medullary cut, we have the spatial visceral afferent column. This column is for taste neuron. The neuron from these 2 cranial nerve functional columns, that is parasympathetic, afferent, and taste, fuse to form the nucleus of the solitary tract or the nucleus solitarius. The nucleus of the tractus solitarius has a V-shaped appearance. As you can see in this image represented in brown, the nucleus of the tractus solitarius is displaced medially, caudally, to the point that it fuses with its counterpart on the opposite side at the level of the closed medulla. Cranially, as it travels towards the pons, it is displaced laterally. Taste neurons are in the most rostral region of the solitary nucleus. Lateral to the embryologically separate but maturely combined GVA and SVA columns, we have the general somatic column constituted by the spinal nucleus of the trigeminal nerve, which you can see in this just reintroduced figure in blue, and most laterally placed during early embryologic life are the spatial somatic afferent neurons. These neurons comprise those for hearing and balance located at the cochlear and vestibular nuclei, which you can see in the just reintroduced figure in pink. So the answer to this question is D. If you did not choose D, stop the video and look at the directions of the arrow in this frame. Next question. The axons of neurons from the spatial visceral efferent nucleus of the pons constitute the motor nucleus for A. Cranial nerve 6, B. Cranial nerve 5 and 7, C. Cranial nerve 12, D. Cranial nerve 8. In this frame, I have reintroduced the cartoonish representation of the menincephalon at the level of the olives prior to their formation and the formation of cranial nerve nuclei, so you can compare it with the cartoonish representation of the metencephalon at about the same stage. In this frame, I am showing the formation of the pontine nuclei from the alar mass. This mass is considered the lower rhombic lip. Now, I'd like you to turn your attention to the alar masses. At this level, there is only one type of afferent functional group, the general somatic afferent group. The general somatic afferent group is here represented by the principal nucleus of the trigeminal nerve and caudally some neurons from the spinal nucleus of the trigeminal nerve. Motor metencephalic nuclei, which at this stage is a single mass, will, with the development of the branchial arches, form 3 nuclear masses. This is the same thing that happens in the menincephalon with the motor nuclear mass. The most main mass is the general somatic efferent column, housing the neurons for cranial nerve 6. In the spatial visceral efferent column, we have the motor nuclei for cranial nerve 5 and cranial nerve 7 for the muscles of mastication and expression respectively. These muscles are considered of branchial origin. And in the general visceral efferent mass, we find the nuclei corresponding to the salivary nuclear group, which include inferior and superior salivary nuclei and the lacrimatory nucleus. So the answer to this question is B. Next question. Which of the following statements is not true? A. The cerebellum forms from the basal plate. B. All cerebellar neurons arise from the interplay of 2 germinal epithelia, the ventricular zone and the upper rhombic lip. C. The cerebellum arises from the first rhombomere. D. The isthmus organizer transverse patterning center at the midbrain-hindbrain boundary regulates cerebellar development. In this frame, you can see the representation of a 28-day-old embryo. I have now carved the ventricular system. By about 30 to 32 days, the external appearance of the embryo looks different. One of the events that contributes to this new appearance is the presence of the pontine flexure. But these changes are not limited to the external appearance. The ventricular system morphologically also changes. One of the most significant changes is the thinning of the roof of the metencephalon and the rostral segment of the myelencephalon, to which we have previously alluded. In this new frame, you can see a simplified sketch of the mesencephalon, metencephalon, myelencephalon, and the pontine flexure. Were we to cut at the level shown, we would see the fourth ventricle, specifically the floor of the fourth ventricle, and the left lateral recess of the fourth ventricle. In this added figure, I am indicating to the lateral recess of the fourth ventricle. Please notice its anatomical position in relation to the rest of the ventricular system in this representation of the adult ventricular system. During early development, the lateral recess is displaced more cranially. Now, let's cast our attention to the sketch, from which I have removed all the labels, and this time make a transverse cut at the indicated level. Such a cut will provide a good view of the fourth ventricle. I have here indicated the sulci limitans for orientation, and now introduce a cartoonish representation of the cut. I have done so to indicate the alar plate. The alar plate is a very important structure at this level, not only in the formation of sensory component of the trigeminal, cochlear, and vestibular nuclei, but also for the embryological origin of the cerebellum and related structures. We will now return to the simplified sketch to make another transfer cut, but this time in the rostral region of the metencephalon, corresponding to the first rhombomer, just below the isthmus organizer. The isthmus organizer is the patterning center and is located in the midbrain-hindbrain boundary. In this new frame, I have now indicated the location of the cut. At this level, you can see the fourth ventricle and the lateral recess of the fourth ventricle. I have now introduced a cartoonish representation of the area of the cut, and I am indicating to the recess in the cartoonish representation as well as in the simplified sketch. Here I have isolated the representation to indicate some of the structures arising from the alar plate. Now I want to call your attention to a neuronal mass referred to as the ventricular zone mass. It is called so because it is believed to arise from the ventricular zone directly, as you can see indicated by the arrows. The next neuronal mass I want to call your attention to is a superior rhombic lip. And the third structure I want you to turn your attention to is the inferior rhombic lip. The inferior rhombic lip, although in this cartoon is represented at the same level as the superior rhombic lip, in a coronal view would be caudal to it. It is from the ventricular zone mass of the first rhombomer and the superior rhombic lip that, under the influence of the isthmus, the cerebellum is formed. So the answer to this question is A. Next question. The inferior rhombic lip contributes significantly to the formation of the cerebellum. A true, B false. The structures that form the cerebellum are the ventricular zone and the superior rhombic lip. Although the ventricular zone and the superior rhombic lip produce different cell lines, they both arise from the first rhombomere, and the increase in their mass together under the influence of the isthmus produces the early cerebellar structures. The prevalent thinking at this point is that neurons destined to become the cerebellum in the ventricular zone mass and the rhombic lip fuse, forming one cerebral plate at each side, and that it is from this cerebral plate that the cerebellum hemispheres are formed. Ultimately, as the plates come together, the vermis is formed. From a histological perspective, as the cerebellum develops, the neurons from the ventricular zone mass and superior rhombic lip arrange themselves, producing the cerebellar adult configuration. So the answer to this question is B. Next question. Which cerebellar lobe is the first one to appear? A. Flocculonodular, B. Anterior, C. Posterior. This is a side look at the mesencephalic junction of an about 11 to 12 week fetus. You can see the isthmus, the cerebral plate, and the fourth ventricle. Were we to look from the dorsal region, we would see the view I have just introduced. The cerebral plate will consist of a relatively large mass formed by cells from the mesencephalic ventricular zone and the upper rhombic lip. We would not see any fissures in the cerebral plate. By the 13th week, we would see that the cerebellar plate now has one fissure called fissura posterior-lateralis that separates the flocculonodular lobe from the rest of the cerebellar plate. By week 16, the fissura prima appears, separating the anterior and the posterior lobes. By 20 weeks, we can see all the structures typical of an adult cerebellum: the floccule, the node, as well as the rest of the vermis, and the tonsils. Before leaving the subject of cerebellar formation, it is important to mention that some authors propose that the caudal mesencephalum contributes to the formation of the cerebellum. So the answer to this question is A. Next question. Which of the following neurons is not a mesencephalic ventral zone derivate? A. Purkinje cells, B. Granule cells, C. Stellate cells, D. Golgi cells. In this diagram, we can see represented and labeled the mesencephalic ventricular zone mass, the superior rhombic lip, and the inferior rhombic lip. I will reintroduce this figure shortly. In this microphotograph of the cerebellar cortex, you can see the Purkinje cell layer, the molecular layer, and the granular layer. Below, not included in the photograph, is the white matter. I have just added an illustration of the cerebellum histology to indicate the embryological origin of the different components represented here. And now I have introduced the schematic representation of the mesencephalum. We will first name those cells arising from the mesencephalic ventricular zone. In the Purkinje cell layer, we find the Purkinje cells. In the molecular layer, we have the stellate cell and the basket cells. In the granular layer, we encounter the Golgi cells. Now I want to call your attention to the cerebellar nuclei. The ventricular zone mass is also the origin of the small cerebellar nuclear cells. All ventricular zone mass neurons are GABAergic. Neurons that originate from the upper rhombic lip are the granule cells and the unipolar Bruch cells. These cells were initially described as having no axon, but more recent articles have described that at least some of them do, as represented in this newly inserted figure. And also from the upper rhombic lip, we have the large cerebellar nuclear neurons. It is important to know that all upper rhombic lip neurons are glutaminergic. So the answer to this question is B. Next question. Which of the following statements is not true? A. Cerebellar nuclei have glutaminergic and GABAergic neurons. B. The external granular layer is present at 40 weeks post-fertilization. C. Neurons derived from the superior rhombic lip are glutaminergic. D. Lamina dissecans is rich in Purkinje cells. E. Purkinje cells are GABAergic. In this frame, you can see a representation of the metencephalon. As you recall from the answer to the prior question, the ventricular zone mass produces GABAergic neurons and the superior rhombic lip produces glutaminergic neurons. I have now added a representation of the cerebellar plate corresponding to 8 to 13 weeks, as you can see indicated. In it, you can see the ventricular zone, intermediate zone, and molecular layer. In the molecular layer, you can see the granular cells forming the external granular layer. The external granular layer is formed from the superior rhombic lip. As it would be expected, cells from the ventricular zone populate the ventricular zone. In the later part of this period, weeks 12 and 13, these cells are represented by the green arrow beginning to migrate to the distalmost region of the intermediate zone. These cells are the Purkinje cell precursors. By 16 to 21 weeks, the granular cell layer has increased in size due to intense cellular multiplication, and some of the granular cells have started migrating towards the intermediate zone. The lamina dissecans, an area devoid of cells, appears between the Purkinje precursor cells and the body of granular cells building up in the intermediate zone. Between 25 to 30 weeks, the mass of granular cells in the intermediate zone grows to the point of occupying the whole of the intermediate zone, and the size of the external granular cell layer begins to dwindle, as does the lamina dissecans and the ventricular zone. By 40 to 47 weeks, the cells in the ventricular zone have become ependymal cells, the external granular layer continues to dwindle, but still will be present until the infant is 9 to 12 months of legal age. The molecular layer houses Purkinje cells dendrites, and their axons reach the cerebellar nuclei. The internal granular cell layer now occupies the intermediate zone. The white matter has steadily increased from the 8th to the 47th week. I will now introduce a specimen of a fetal cerebellum to emphasize the presence of the external granular layer. This specimen corresponds to an about 28-week conceptional age fetus. You can see the pons and the cerebellar fovea. I will now enlarge the area in the rectangle. As you can see, notice the increased color of the rim of the fovea indicated by the arrow, and also in this other fovea. I will now enlarge the area inside the yellow rectangle to label the different layers. The external granular layer, the molecular layer, the Purkinje cell layer, the lamina dissecans, and the internal granular layer. The area within the bracket represents the intermediate zone layer. So the answer to this question is D. Next question. Which cells guide the external granular layer cells to reach the internal granular layer? A. Bergmann glia cells. B. Muller glia cells. C. Oligodendroglia. D. Purkinje cells. In this representation of a cerebellar cortex, you can see illustrated the Bergmann cells. You can also see the granule cells at different positions, clinging to the radial fibers of the Bergmann glia cells. This migration ends by transforming the cells in the external granular layer to the internal granular layer cells. This transformation is not complete till 9 to 12 months of legal age. So the answer to this question is A. Next question. Which of the following structures derives from the inferior rhombic lip? A. External cuneate nucleus. B. Inferior olive. C. Pontine nuclei. D. All of the above. In this frame, you can see a cartoonish representation of the pons. The cut is done in such a way that it captures the upper segment of the lateral recess of the fourth ventricle. In this cut, we can see the ventricular zone mass, the superior rhombic lip, and the inferior rhombic lip. The mass of cells that constitute the inferior rhombic lip extends to the medulla, and in the medulla it is simply labeled the alar plate of the medulla. From the inferior rhombic lip, the following structures closely related to the cerebellum arise: the external cuneate nucleus, the lateral medullary reticular formation, the inferior olive, the pontine reticulotegmental nucleus, and the pontine nuclei. So the answer to this question is D. Next question. the superior colliculi derives from the alar plate. A true, B false. This is a representation of the brainstem. In the area corresponding to the midbrain, I have added 5 structures: substantia nigra, red nucleus, mesencephalic nucleus of the trigeminal nerve, nucleus of the trochlear nerve, colliculi, the somatic efferent nuclei of the oculomotor nerve, and the Edinger-Westphal nucleus. I will now proceed to explain the embryological development of these structures. Early on, the embryonic mesencephalon keeps a formation much like the spinal cord. The alar plate in the back, the basal plate in the front, separated by the sulcus limitans. This sulcus ends here. Rostral structures do not have sulci limitans according to most authors, although this view has been challenged. Be it as it may, from the basal plate, general somatic efferent column, the nucleus of the third cranial nerve going to most extraocular muscles, and the muscles of the fourth cranial nerve for the superior oblique will form. Also from the basal plate, but from the general visceral efferent group, the Edinger-Westphal nucleus will form. Yet time and the appearance of new structure will produce significant changes in the location of these nuclei. The general visceral efferent group from their lateral position will become a single mass, forming the Edinger-Westphal nucleus at the level of the superior colliculi. Also, at the level of the superior colliculi, we find the third cranial nerve nuclei, flanking the Edinger-Westphal nucleus. At the level of the inferior colliculi, we have the nucleus of cranial nerve 4. The superior and inferior colliculi develop from the alar plate. Extending vertically from the superior to the inferior colliculi, we have the mesencephalic nucleus of the trigeminus. This nucleus is populated by first-order sensory neurons. It contains cell bodies of primary afferent proprioceptors, 1A afferents that innervate the jaw closing muscles, the masseter, temporalis, and medial pterygoid, and also the periodontium. This makes this nucleus unique. The mesencephalic nucleus of the trigeminal nerve can be considered a cranial nerve ganglia displaced into the brainstem. Controversy exists as to the origin of the red nucleus and the substantia nigra. Some authors describe the red nucleus and the substantia nigra as originating from the alar plate. Other authors describe these nuclei as originating from the basal plate. So the answer to this question is A. Thank you very much for your attention.